After the colonoscopy is completed, you'll be taken to a recovery area where your driver will be waiting with you. You won't have any discomfort after the procedure. No rectal bleeding, no abdominal pain. You may have a little bit of stomach gas, but it's very minor. You'll be able to return back to normal activity soon after the procedure. So the number one question that I have after getting a colonoscopy performed is, when can I eat? You will probably be a little bit hungry after the procedure, just because you'll be on a liquid diet the day before, but you can reward yourself by having a good steak or hamburger lunch after having the procedure done. You can eat soon after. So a colonoscopy is a very safe procedure. The doctor who will be performing your procedure has done thousands of them. The risks are very low. The top 3 risks with a colonoscopy include bleeding, but we minimize that by having you hold such medications such as blood thinners and things like that that could make that risk a little bit higher. We also have the small risk of having something like a bowel perforation, but your gastroenterologist is very skilled and they have different ways to maneuver that scope around your colon in a way that is safe. There's also a risk of having oversedation. The medicine that we use is called propofol. It has a very short half-life, meaning that it leaves your system very quickly. It puts you into a deep, sound sleep, but once it leaves your system, you don't have any of the lingering side effects of some of the old or more traditional sedation methods. You'll be able to return back to normal activity after the procedure. Of course, we advise that you can't drive afterwards just because you will have been put to sleep that day, but you will feel fine, you'll feel normal, and you won't have any negative side effects from the actual procedure itself. During the colonoscopy, if a polyp is found, it will be removed during the procedure. That polyp will be sent to an outside lab where it will be read under a microscope, and that's how we'll determine the type of polyp it is. There are 2 types of polyps that we're really looking for. There are the benign polyps that are called hyperplastic. Those polyps have no risk of transforming into colon cancer. The ones that we're really screening for, the ones that are considered to be high risk, are called adenomas. If the pathologist lets us know that there are some adenomas that are found inside your colon, your screening time may be reduced from the normal 10 years to anywhere from 3 to 5 years, as far as when you'll need to repeat the colonoscopy. After the colonoscopy itself, once you're awake from the sedation, the doctor will come over there and he will present you some documents and pictures of things that he's found during the colonoscopy. He'll take pictures of every polyp that's removed. He'll take pictures of anything that's abnormal, or pretty much it gives you an idea of what he sees when he's doing the colonoscopy. As far as the results of the pathology, we will call you with those results and let you know what our recommendations are at that time. Right. If there are polyps found in your colon during the procedure, it really depends on what type of polyp is found. That will determine the interval of when you need to have this procedure repeated again.